Today we will be demonstrating different therapeutic exercises that focus specifically on hip musculature. Patellofemoral pain is a common impairment that many people seek medical attention for. Here are two proven exercises by Kobayashi et al. That help increase abductor strength and external rotation strength of the hip, which are commonly weak in patients with patellofemoral pain. Isolated hip abductor strengthening is performed with the patient standing on both feet with elastic tubing tied just above the ankle at one end and attached to a rigid pole at the other. The tubing length for hip abduction is individualized across patients based on their lower limb length, the distance from the anterior superior iliac spine to the medial malleolus. The distance between the exercise limb and the pole is adjusted to remove slack from the tubing. The patient is allowed to hold on to a pole for balance during the exercise. The exercise is performed by abducting the hip to approximately 30 degrees while keeping the pelvis level. Another exercise found by Kobayashi et al. To increase hip strength for women with patellofemoral pain syndrome is isolated hip external rotator strengthening. This is performed with a patient seated at the edge of a treatment table and the knee flexed to 90 degrees. A strap is used to stabilize the thigh to prevent sagittal and frontal hip plane motion. Elastic tubing is tied around the ankle and secured to a rigid pole. The tubing length for hip external rotator strengthening is individualized across patients based on their thigh length, or the distance from their anterior superior iliac spine to the medial femoral epicondyle. The distance between the exercise limb and the pole is adjusted to remove slack from the tubing. The exercise is performed by externally rotating the hip to approximately 30 degrees. This is done for 10 repetitions for 3 sets. Some other exercises that help increase strength in hip musculature include quadruped leg lifts and bridging. Quadruped leg lifts are used to isolate the gluteus maximus. Starting in the quadruped position, the patient extends the hip while keeping the knee flexed to avoid using the hamstrings. This should be done with the head and spine in neutral. They should not extend the hip beyond the available range of motion to avoid stress to the sacroiliac or lumbar sacral joints. This should be done for 10 repetitions for 3 sets. Bridging is used to strengthen the hip extensors. Starting in hook-lying position, have the patient press the upper back and feet into the mat, elevate the pelvis, and extend the hips. Resistance can be added against the pelvis. This is done for 10 repetitions and for 3 sets to increase strength of the hip extensors.